If you're over 60, listen closely, because there's a quiet danger most people never see coming. It's not junk food. It's not stress. It's not even genetics. It's something you probably took this week, a pill you trust, a pill your doctor once approved. And it may be putting silent pressure on your heart right now. Here's the scary truth. As we age, our bodies change faster than our prescriptions do. Meds get refilled. Doses stay the same. But inside, your heart, kidneys, and blood vessels are playing by new rules. And that's where the risk begins. What if the fatigue you feel isn't just age? What if the swelling in your feet isn't normal? What if the dizziness, brain fog, or shortness of breath are warning signs your body is trying to send? Most seniors never get told this. They assume it's part of getting older. Doctors stay busy. Prescriptions stay on autopilot. And here's what really matters. Many of the most dangerous pills for older adults are not rare. They're common, FDA approved, found in millions of homes across America, taken every single day by people who think they're doing the right thing. This video isn't here to scare you. It's here to open your eyes. Today, we're counting down the most common medications that can quietly damage the hearts of older adults, especially after 60. Some will sound familiar. Some will shock you, but every single one deserves a second look. Stay with me, because number 5 is sitting in almost every medicine cabinet. It's used for everyday pain, aches, stiff joints, and in aging bodies. It can slowly overload the heart without making a sound. And here's the part most people miss. You won't feel it happening. No alarms, no sharp pain. Just small changes you brush off. Until one day, you can't anymore. That's why the next few minutes matter more than you think. Now let's talk about number 5. This one feels harmless, familiar, almost comforting. It's the pill people grab without thinking twice. Knee pain, back pain, headaches, a sore shoulder in the morning. You've done it. Almost everyone has. Ibuprofen, naproxen, diclofenac. These painkillers live in millions of homes. They're cheap, easy to buy, no prescription needed. And that's exactly why seniors underestimate them. Here's the part nobody explains clearly. These drugs don't just calm pain. They change how your kidneys handle salt and water. When you're younger, your body adjusts fast. When you're older, that system slows down quietly. So what happens? Your body starts holding onto extra fluid. Ankles swell. Shoes feel tighter. Legs feel heavy by evening. You feel more tired than usual. Most people say, that's just age, but very often, it's not. That extra fluid has to go somewhere. Your heart takes the hit. It works harder, pumps longer, stays under pressure all day. If you already have high blood pressure or heart issues, this extra strain can push things in the wrong direction. And it doesn't stop there. These pain pills can raise blood pressure, reduce kidney blood flow, and increase the risk of heart attack or stroke. Even short-term use can be risky when mixed with common heart or blood pressure meds. Here's what makes this scary. You don't feel your kidneys struggling. You don't feel your heart straining. The signs are subtle. Swelling, fatigue, lightheaded moments you brush off and ignore. Because they're sold over the counter, people assume they're safe. But easy to buy doesn't mean easy on your heart, especially after 60. And the next medication on our list. It's not for pain at all. It's meant to help you sleep and calm your mind. But for older adults, it may be quietly taking something far more valuable. Now, number 4. This one doesn't touch your joints or your stomach. It works on your brain, your nerves, your sleep. And for many older adults, it feels like a blessing at first. These are meds often given for anxiety or sleep. Names like lorazepam, diazepam, temazepam, they're called benzos. They slow the brain down. That's why they calm racing thoughts and help you drift off faster. Sounds helpful, right? Here's the problem. In aging brains, that slowdown doesn't stay gentle. It goes too far. Reaction time drops. Balance weakens. Muscles don't respond as fast. Your mind feels foggy when it should be sharp. And this is where things get dangerous. Think about nighttime, getting out of bed, walking in the dark. One moment of dizziness, one missed step. Falls are already risky after 60. Benzos quietly multiply that risk. And a fall, at this age, isn't just a bruise. It can mean surgery, rehab, or losing independence. But there's more. Long-term use has been linked to memory problems and confusion. At first, it's small stuff. Forgetting names, losing focus, mid-sentence, feeling off. Most people blame aging. Very few blame the pill. Then comes dependence. Your body adjusts. The same dose stops working. You need more to sleep or feel calm. And stopping suddenly, that can trigger anxiety, shaking, panic, and severe insomnia. The pill becomes the trap. This doesn't mean these meds are evil. They have a place. But for seniors, they need caution, short use, and regular review. Because sleep should restore your strength, not quietly steal your balance, clarity, and confidence. And the next pill on our list, millions take it daily for comfort. But over time, it may be draining your body in ways you never expected. Now, let's move to number 3. This one is so common that many people don't even think of it as a real medication anymore. It's the little pill taken for heartburn, acid reflux, and that burning feeling after meals. Relief feels instant, and that's why people stay on it for years. Omeprazole, pantoprazole, esomeprazole. These are proton pump inhibitors, or PP, they shut down stomach acid fast. The pain fades. Sleep improves. Eating feels normal again. For short-term use, they can be incredibly effective. But here's what most seniors never get told. These meds were never designed for long-term daily use, especially not month after month, year after year. Yet millions of older adults take them without ever checking if they still need them. Stomach acid isn't useless. It helps your body absorb critical nutrients: calcium, magnesium, iron, vitamin B12. When acid stays low for too long, those nutrients don't get absorbed properly, and the damage happens quietly. Low calcium weakens bones. That raises fracture risk, especially hip fractures, which can change life overnight. Magnesium loss can affect heart rhythm, cause muscle cramps, fatigue, and dizziness that feels hard to explain. Low iron and B12 bring anemia, nerve problems, and brain fog. Energy drops. Memory slips. Most people say, it's just age. Rarely do they blame the reflux pill they've been taking every morning. There's another issue. Stomach acid protects you from harmful bacteria. When it's suppressed too long, infection risk goes up. Severe gut infections hit seniors harder and can lead to dehydration and hospital stays. PPs aren't the enemy. But long-term, unchecked use is the problem. Comfort today shouldn't slowly steal strength tomorrow. And coming up next is a medication meant to protect your heart, but when used the wrong way, it can quietly put it in danger. Now number 2. This one feels confusing, even unfair. These are the pills meant to protect your heart, lower your blood pressure, reduce strain, help you live longer, and many times they do exactly that. But here's the twist most seniors never hear. In the wrong dose, or the wrong combination, these same meds can quietly become the problem. Let's start with diuretics, often called water pills. They help your body get rid of extra fluid and salt. Sounds good, but in older adults, they can pull too much. Dehydration creeps in. Potassium drops, sodium shifts. You stand up and feel dizzy or weak. That lightheaded feeling, it's not always age. Then there are calcium channel blockers. They relax blood vessels and lower pressure. Helpful, yes, but they can also cause swollen ankles, slow heart rate, and deep fatigue. You feel heavy, sluggish, not yourself. Beta blockers slow the heart. That can protect it, but sometimes they slow it too much. Shortness of breath shows up. Hands and feet feel cold. Exercise feels harder than it should. And for people with diabetes, these meds can hide warning signs of low blood sugar. Here's the real issue. The body changes with age. Kidneys filter slower, blood vessels stiffen, salt and fluid balance shifts. A dose that worked perfectly 10 years ago may now be too strong, and most seniors don't take just one heart pill, they take several, one to balance another, another to fix side effects. The mix grows quietly. You start feeling foggy, less steady, low on energy. You assume it's aging, but sometimes, it's medication overload, stressing the heart instead of helping it. These meds save lives, but they must be reviewed, adjusted, fine-tuned, because coming up next is the biggest danger of all. Not one pill, but all of them together. Now we reach number 1. And this is the one almost no one talks about, because it's not a single pill, it's the pile, the routine, the combination you stopped questioning years ago. It's called polypharmacy, and for older adults, it may be the most dangerous risk of all. Here's a fact that should stop you cold. Nearly half of adults over 65 take 5 or more medications every single day. Many take 8, 10, even more. Blood pressure meds, cholesterol pills, sleep aids, pain relievers, acid reducers, supplements, each one added for a reason, but rarely reviewed as a whole. Every added pill increases the chance of side effects. Every combination raises the risk of dangerous interactions. Your liver slows with age. Your kidneys work harder, and your heart feels the pressure from all of it. The signs aren't dramatic. They creep in quietly. You feel tired all the time, less sharp, less steady. Your balance feels off. Your digestion changes. Your mood shifts. Most people say, this is just getting older, but many times, it's not age at all. Here's the scary part. Some of those medications may no longer be needed. The original problem improved, or one drug caused a side effect that led to another prescription. A quiet chain reaction that never stops. Polypharmacy doesn't just strain the heart. It steals energy, clarity, and independence. Falls become more likely. Hospital visits increase. Life slowly shrinks, not because of disease, but because of overload. The solution isn't quitting everything. That's dangerous. The solution is review. A full medication check with a doctor or pharmacist who looks at the big picture. Removing what's outdated, lowering doses. Simplifying the plan. Many people feel the difference quickly. More energy, clearer thinking, better balance, fewer dizzy spells. Sometimes they say, I finally feel like myself again, because real health isn't always about adding more pills. Sometimes it's about letting go. And we're not done yet. There's still more you need to know about protecting your heart as you age. What comes next could change how you look at every prescription you take. Before you think this only applies to other people, pause for a second. Because this problem doesn't start with 5 pills. It starts with one prescription that never gets questioned again. One refill after another. One small side effect you ignore. Here's how it usually happens. You get a pill for blood pressure. It causes swelling, so you get another pill for that. Then sleep gets worse, so a sleep aid is added. Acid reflux shows up. Another pill. Pain creeps in. Another bottle. None of these feel dangerous alone, but together, they change how your body functions day to day. Your heart has to adapt to shifting blood pressure. Your kidneys work overtime filtering chemicals. Your nervous system tries to stay balanced while signals are being slowed or blocked, and eventually, something feels off. You're more tired than you used to be. Walking feels harder. You hesitate before standing up. Your mind doesn't feel as sharp. And you start planning your day around how you feel instead of what you want to do. Most people never connect this to medication. They say, "I'm slowing down," but sometimes, it's not you. It's the load your body is carrying. This is why medication reviews matter more after 60 than at any other age. Not quick visits, real conversations. What do you still need? What can be lowered? What can be stopped safely? Because the goal of medicine isn't just to keep you alive. It's to help you live well. And coming up next, we're talking about the warning signs your body gives when medications are starting to do more harm than good. Your body gives signals long before a real emergency hits. The problem is, most people don't know how to read them. Or worse, they're told to ignore them. That's normal for your age. But many times, it's not normal at all. Let's talk warning signs. Sudden fatigue, that doesn't make sense. Feeling wiped out after small tasks. Needing more naps than usual. That can be your heart working harder than it should because of medication strain. Then there's dizziness, especially when you stand up. That light, floaty feeling, or moments where the room spins for a second. Many seniors think it's balance or ears. Often, it's blood pressure dropping too fast because meds are too strong. Pay attention to swelling, ankles, feet, legs, rings, feeling tight, shoes, not fitting by evening. That can signal fluid imbalance, either too much being held in or too much being pulled out. Both stress the heart. Brain fog is another red flag. Trouble focusing, forgetting words, feeling mentally slow. People fear dementia right away. But sometimes, it's medications dulling brain signals or interacting badly together. Shortness of breath matters too. Not just during exercise, but simple things. Walking to the mailbox. Climbing a few steps. If that feels harder than it used to, it deserves attention. Here's the key point. One symptom alone might not mean much, but several together. That's your body asking for help. And the mistake most people make is waiting. Waiting until a fall, a hospital visit, a scare. But the next part is about what you can do before it ever gets that far. So what do you actually do with all this information? Not panic, not quit meds on your own, and definitely not ignore it. The smartest move is simple, but most people never take it. You ask for a real medication review, not a rushed visit, not a quick refill. A sit-down conversation where every pill gets questioned. Why are you taking it? When was it started? Is it still needed now? Could the dose be lower? Could something be removed safely? Here's something many seniors don't realize. Doctors often focus on one problem at a time. Heart doctor looks at the heart. Sleep doctor looks at sleep. Stomach doctor looks at reflux, but your body isn't split into pieces. Everything affects everything. That's why pharmacists can be powerful allies. They're trained to spot drug interactions most people miss. They see patterns, overlaps, red flags that don't show up on a single chart. Bring everything. Prescriptions, over-the-counter pills, vitamins, herbal supplements, even natural products. Because natural doesn't always mean harmless, especially when mixed with heart meds. And speak up. If a pill makes you feel worse, say it. If you feel dizzy, foggy, weak, or off balance, mention it. Those details matter more than numbers on a page. One change at a time is key. Slow adjustments. Careful monitoring. That's how you protect your heart without risking withdrawal or sudden problems. Most people are shocked by the results. Fewer pills, lower doses, better energy, clearer thinking, better balance. Sometimes within weeks. Because good medicine should make life easier, not heavier. And in the final part coming up, we're tying everything together. One mindset shift that could protect your heart for years to come. Here's the mindset shift most people never make. More medication doesn't always mean better care, especially after 60 hours. In fact, sometimes the healthiest move is subtraction, not addition. Think about this. Every pill changes chemistry, timing, absorption, blood flow. When your body was younger, it bounced back fast. Now, it needs more margin, more simplicity, more balance. That's why the goal isn't to chase perfect numbers, not perfect blood pressure, not perfect cholesterol. The real goal is function. Can you walk confidently, think clearly, sleep well, get through the day without feeling wiped out? Those are the markers that matter. Too often, seniors sacrifice how they feel just to satisfy a chart. Numbers look good, but life feels smaller, slower, heavier. That's not success. A heart-protecting plan should support your independence, your stability, your energy, not quietly take them away. And that only happens when medications are reviewed with your real life in mind. This also means regular check-ins. What worked last year may not work now. Bodies change. Needs change. Meds should change too. And here's something powerful. You're allowed to ask questions. You're allowed to say, I don't feel right on this. You're allowed to ask if there's a safer option. That's not being difficult. That's being smart. Because the heart isn't just a pump. It's what keeps you moving, thinking, living fully. Protecting it means protecting the whole system. And in the next part, we close this out with one final reminder every older adult needs to hear before they take their next pill. Before you take your next pill, remember this. Medications are tools, not trophies. Taking more doesn't mean you're doing better. It just means your body is handling more. And after 60, handling more isn't always safer. Here's the truth, nobody says out loud. Aging doesn't make you weak, it makes you different. Your body becomes more sensitive, more reactive, more honest. It tells you faster when something isn't working. That's why paying attention matters. How do you feel an hour after your meds? How do you feel by evening? Do you feel steady when you stand? Clear when you talk? Energized enough to enjoy the day? Those answers matter more than a label on a bottle. Protecting your heart isn't about fear. It's about awareness. Knowing that common pills can have uncommon effects as you age. Knowing that comfort today can sometimes cost strength tomorrow if no one's watching closely. This doesn't mean rejecting medicine, it means partnering with it, using it wisely, adjusting it when your body asks for change. And here's the good news. Many people who review their meds don't just feel a little better, they feel like themselves again. More confident walking, sharper in conversation, less afraid of falling, more willing to live. That's what heart health really looks like. Not just surviving, but thriving. So talk to your doctor, talk to your pharmacist, ask the questions you were told not to ask. Because your heart, your balance, your clarity, and your independence are worth protecting. And if this message helped you, pass it on. Someone you care about may need to hear it more than you realize. Let me leave you with something simple, but powerful. No one knows your body better than you do. Not a chart, not a guideline, not even a prescription label. If something feels off, it matters. Too many older adults stay silent. They don't want to complain. They don't want to be difficult. So they tolerate fatigue. They accept dizziness. They adjust their lives around weakness, and slowly, they shrink their world. But that's not how it's supposed to be. A healthy heart supports movement, confidence, independence. It doesn't just keep you alive, it keeps you living. And medications should support that goal, not quietly work against it. This is why timing matters. Reviews matter. Speaking up matters, especially as the years pass. Because what protected you once may now need adjustment. You deserve care that fits who you are today, not who you were 10 years ago. You deserve to feel steady on your feet. Clear in your mind, strong enough to enjoy your days. And if you've made it this far in the video, that already tells me something. You care about your health or about someone you love. That alone puts you ahead of the curve. There's one final thought I want to share with you. One last reminder that ties everything together, and it's coming up next. Here's the final takeaway. Protecting your heart isn't about chasing fear. It's about staying curious, staying involved, staying awake to what your body is telling you every single day. The most dangerous moment isn't when a medication is prescribed. It's when it's never questioned again. Years pass, bodies change, but the pills stay the same. And that's where silent damage can begin. You don't need to remember every drug name. You don't need to study medicine. You just need to stay present. Ask simple questions. Do I still need this? Is this dose right for me now? Could this be why I feel off? Those questions can protect your heart more than you realize. A strong future isn't built on ignoring signals. It's built on listening early, adjusting early, choosing quality of life, not just longevity. If this video helped you see medications differently, that's a win. If it helped you think about your heart, even better. And if it helped you decide to speak up at your next appointment, that could change everything. Share this with someone you care about. A parent, a partner, a friend, because sometimes the most powerful medicine is awareness. Your heart has carried you this far. Make sure the choices you make next help it carry you even further.